Good day, ladies and gentlemen. My name is Dr. Dehinbo, and I will be presenting the Wayne State Family Medicine Quality Improvement Project. The title of our project is POCUS Bingo. This was prepared by myself and Dr. Kanika Batara, Dr. Alexander Christophus, Dr. Simon Gawkin, Dr. Zainab Rashid, Dr. Olivia Schimmel, Dr. Marcus Wong, and our supervisor, Dr. Catherine Cox. Point-of-care ultrasound, or POCUS, is an essential diagnostic tool that can improve clinical outcomes, increase efficiency of care, and lower costs. Point-of-care ultrasound is increasingly recognized for its diagnostic utility across medical specialties, prompting its integration into medical education to enhance clinical decision-making. The American Academy of Family Physicians recommends POCUS training as part of family medicine residency programs. Last year, we launched a quality improvement project to establish a POCUS curriculum within the Wayne State University Family Medicine program. This year, we aim to build upon this foundation by increasing POCUS participation. We wanted to enhance resident comfort with POCUS for medical decision-making, patient evaluation, and treatment. We plan to accomplish this by applying gamification principles and utilizing a novel bingo card system. We hope to incentivize residents' engagement in POCUS using the bingo card system to improve confidence in patient assessment and therapeutic intervention. We created a bingo card with 24 point-of-care ultrasound tasks and then digitally distributed them to Wayne State University Family Medicine residents. Each entity in the POCUS bingo card had been taught previously or would be taught throughout the academic year. Didactic sessions were held covering each of these tasks, and residents had access to online POCUS modules. Didactic sessions used pictures, videos, standardized patients, and ultrasound models. Additionally, guest lecturers with POCUS expertise also provided POCUS education. For example, residents were able to learn from an upper extremity POCUS cadaver workshop in November of 2023 hosted by Dr. Simona. Residents also had access to the Butterfly IQ Academy, which provided a comprehensive library of POCUS educational modules. 16 residents received the bingo cards in October of 2023. An anonymized survey using a 5-point scale was given prior to the bingo card and didactic training sessions. The survey was then again given after the final training session on January 30th of 2024. The 5-point scale of the survey included point-of-care exposure prior to residency, confidence in using point-of-care ultrasound for patient assessment, confidence in using the POCUS for procedures, number of patients independently evaluated, and the number of tasks completed. Residents were also offered incentives to complete the bingo card. The incentives included a POCUS lapel pin for scoring bingo and an administrative half-day for completing all the tasks. This is an image of what the bingo card looked like. As residents completed each task, they would cross off the task from the bingo card. These are the different categories: procedure, organ, circulation, ultrasound education, and soft tissue / MSK. Of note, squares with multiple options for completion will be marked complete if one of the exams or procedures is performed. So for example, if a resident had done an ultrasound guided injection of the knee, they were able to cross off that section here in the procedure section, but also were able to cross off the knee exam in the soft tissue section as well. The same would go for if they did an ultrasound guided injection of the shoulder, they were able to cross it off here as well as here. Of the 16 resident participants, 2 opted out of the study, resulting in 14 usable data points. When looking at the pre-residency POCUS exposure, the average between participants was about 5 to 10 hours. When examining the average number of tasks completed, the average was 11 out of the 24 boxes on the POCUS bingo card. Paired sample t-tests were conducted to assess the impact of a POCUS curriculum on resident confidence in evaluating patients with point-of-care ultrasound. The results revealed increases in confidence levels post-curriculum. As you can see here, in the confidence in patient assessment in the pre-survey was 1.27 and had increased to a 2.5 in the post-survey. Similarly, the confidence in performing procedures went from 1.8 in the pre-survey to 2.57 after the bingo card and didactic sessions. Again, you can also see here that the number of patients evaluated went from 1.67 in the pre-survey to 2.21 in the post-survey. Although we did not achieve true statistical significance, likely due to insufficient power and low sample size, we still observed a profound effect that the bingo card had and the didactic sessions had on our residents. We also wanted to compare resident participation rates from last year's QI project and this year, and we found that integrating the POCUS bingo had increased participation from 34% to 56% this year. This study demonstrated that utilizing a novel bingo card to gamify our POCUS curriculum considerably increased resident participation and resident confidence in utilizing POCUS for both patient assessment and performing procedures. Next steps include expanding training sessions and participation with continued integration of the bingo card. In closing, this tool could enable analysis of specific task completion and allow refinement of our curriculum by identifying individual organ systems requiring further practice.